Okay, so let's begin our discussion for today. So again, good morning to everyone. We'll be discussing anemia for today. So this is chapter 16, okay? The start of chapter 16 until um until 17. Hopefully we'll be able to finish that so that um on the coming weeks, on the coming days, on the meetings for our hematology, we will just be covering the last topics that needs to be discussed for the semi-finals. So anemia, okay, so we'll be talking about anemia. So first and foremost, the term anemia was actually derived from a Greek word anemia, which means without blood. So before, um, it actually is because of a decrease in hemoglobin concentration or a decrease in the number of RBCs. So whenever we are talking about anemia today, um, there are two things, two possible reasons why there is anemia. It's either because of a low hemoglobin concentration or low RBC count. Okay? Low RBC count. So going back to how we discussed chapter 7 before, we all know that hemoglobin is the protein that carries, okay, that carries your oxygen into your muscles. So it is into your cells. So it is very important for you guys to remember that hemoglobin is a key player in your in anemia. But as we discuss this today, we will actually also be talking about different types of anemia, like iron deficiency anemia, anemia secondary to chronic disease, and other sideroblastic anemia, which is actually related na to porphyria. But for today, let's go first with anemia. So again, anemia is actually a state whereby oxygen levels is depleted. So meaning to say there is hypoxia. Okay, there is tissue hypoxia inside the body. So it is very important for you to remember that anemia, okay, anemia again is because of lack of hemoglobin or decrease in RBC count. Okay, decrease in RBC count. So to define what anemia is, the functional definition of anemia is that it is a decrease in oxygen carrying capacity of your blood. So either hemoglobin, decrease in hemoglobin or decrease in RBC count, both will be attributed to anemia. So again, functional definition is it is the decrease of oxygen carrying capacity of the blood. The conventional definition, on the other hand, is the decrease in RBCs, hemoglobin, and hematocrit below the reference range for healthy individuals of the same age, sex, and race under similar environmental condition. I need to highlight here hematocrit. Why is hematocrit also low? Remember that hematocrit is actually your packed red cell, okay? It is your packed red cell. So meaning to say, if there is a decrease in your red blood cells, automatically there will also be a decrease in your hematocrit level, okay? Hematocrit level. But not all the time that there is a decrease in RBC, automatically, or decrease in hemoglobin, decrease din yung RBC. Hindi laging ganon. Okay? So, at the same time, later on, what in your quiz, I included there, nakita nyo ba yung quiz ninyo kanina that what would be the condition, shift to the right or shift to the left for mountaineers at the summit of Mount Everest? Shift to the left or shift to the right? Shift to the left or shift to the right?
Left po.
Shift to the left, correct. It is shift to the left. And did you know that there are that hemoglobin and hematocrit and RBC count varies depending kung saan ka nakatira. Why? Because people living in higher altitude, okay? People living in higher altitude has higher hemoglobin, RBC, and hematocrit count. Bakit? Because the higher the altitude, the lower the oxygen level there is, the more na mas kailangan nila ng hemoglobin that will be carrying more oxygen from the from the air. So the reason why I put that in your quiz kanina is because we'll be using that as an example here. So some environmental condition may cause the variation when it comes to our hemoglobin, hematocrit, and RBC levels. Okay? So moving forward, when it comes to the clinical findings, of anemia, one very important thing to do, okay, I'm on page 252 ha, 252 of chapter 16. So one important um thing to do when assessing anemia is always patient history and clinical findings. Okay? Clinical findings. So history and physical examination are very important components in making a clinical diagnosis for your anemia. Why? Because similarly to diabetes mellitus, it can actually go asymptomatic. Okay? It can go asymptomatic, and it can also present signs and symptoms that are actually similar to other conditions. Okay, so here what we have is that we have a classic symptoms which are fatigue and shortness of breath. Fatigue and shortness of breath is very much common because of the decrease in the oxygen delivery in the tissues. So meaning to say, remember, 'di ba? Dudugtong ko ulit siya, i-correlate ulit natin siya with what happened inside your body. Remember that most of your metabolic processes requires oxygen, correct? It requires oxygen. So meaning to say, if it does requires oxygen, okay, if it does requires oxygen, then it just goes to show, okay, it just goes to show that your it just goes to show that some of those processes will also stop. If classic symptoms for anemia, once again, is fatigue and shortness of breath. So remember, guys, bakit may fatigue and shortness of breath? Because again, most all of your cells require oxygen for it to all of your cells except for RBC na lang siguro requires oxygen for the glycolysis, okay, for glycolysis, for the production of energy. That is the reason why kapag may anemia ka, talagang very distinct yung fatigue and shortness of breath. Next is that we also have anemia if hemoglobin is less than 12 grams per deciliter in men, or less than 11 grams per deciliter in women. So this is the anemia basing on the hemoglobin levels of your patient. So please take note of this one, guys. Please take note of the um, numbers, okay? So in the semifinals, kung mapapansin nyo, ang dami nyong i-memorize ng mga reference intervals, which is very important for you to know, and very important for you to remember. Kasi that would be the basis if you are going to um, if you're going to diagnose a patient having anemia or hindi. Okay? So let's move forward. So that is anemia. And at the same time, we also have moderate anemia. So may levels ang anemia natin. Number one, because sabi ko nga kanina, some patient might actually present asymptomatically, okay? And then some patient would actually have severe symptoms already. So for moderate anemia, their hemoglobin levels is from 7 to 10 grams per deciliter. So this may not produce any clinical signs and symptoms if the onset of anemia is slow. So meaning to say, um, may anemia na yung patient, but it can actually be, your patient can still be normal. It's your patient can still be ambulatory, and then when the time comes that their hemoglobin level drops less than 7 grams per deciliter, that is now where that you can observe tachycardia, hypotension, and symptoms of blood loss. Okay, and symptoms of blood loss. So it's very important for you to remember these things because these are actually still part of your physical and history taking. Okay? So you can observe na walang symptoms ang moderate anemia, but severe anemia, you can actually observe tachycardia, hypotension, and um, other symptoms that can affect your patient already. So the severity of anemia can actually be gauged based on their hemoglobin. So kung mapapansin ninyo, we have moderate anemia and severe anemia. And our basis there for saying that is their hemoglobin levels. Okay? Their hemoglobin levels. Again, their hemoglobin level. So severe anemia, 7 grams per deciliter. And for moderate anemia, you have um, 7 to 10 grams per deciliter. So, this one is grams per DL. And then, kung mapapansin ninyo, in other, tawag dito, in other references, ang reference interval natin when it comes to hemoglobin is actually grams per liter. Okay? Pag grams per liter, parehas lang naman yan. Kunwari ito, i-ano ko na sa inyo ha. Kunwari 120 grams per DL, deciliter ha. Kapag naman kinonvert natin yan sa grams per liter, that is 120. Nagets ba ako? 120, 110 grams per liter. Okay? Ito DL, grams per DL. So, grams per DL, grams per DL. Pag nag-liter yan, nagdaglang kayo ng 0, 70 to 100, and then less than 70. Okay? So, moving forward, okay? Moving forward, nasan na ako kanina? Nasa physiologic adaptation. Okay. So, what are the common physiologic adaptation that can be observed in patients with anemia. So patients who develop anemia either from acute blood loss, from severe hemorrhage can respond with different physiologic changes. So as you can see here, what are the physiologic adaptation of your body? Syempre, kapag may anemia, your body would still try to compensate. Your body will still try to make some adjustment para hindi kaagad-agad mag-collapse or hindi agad-agad magkaroon ng cardiac arrest. So as you can see here, in cases of sudden loss of large blood volume, your heart rate, your respiratory rate, and your cardiac input will also increase. Okay? Will also increase. So yung nalalabing dugo on your system will actually be pumped faster and your respiratory rate will also be increasing. And this is one important thing for you to remember, guys, that the redistribution of blood flow will be allotted to the most important organs of your body, which are your heart, your brain, and your muscles. Okay? Your heart, your brain, and your muscles. So as you can see, when there are cases like trauma where there is a blood volume decrease, ang mangyayari is that your body now will try to redistribute the blood, prioritizing your heart, your brain, and your muscle. So these are key, okay? These are key organs that are very important for your survival. Kasi once that it is your heart, your brain, or your muscle that shut down, mahihirapan ng mag-recover yung patient, and it can even lead to death. Okay? So, having said that now, in cases naman of slow loss of blood, the 2,3-bisphosphoglycerate will be increased, and your primary oxygen sensing system will also be alerted. So later on, we will be discussing ano yung mechanism ng katawan natin when it comes to anemia. Okay? So again, if there is slow loss of blood, your 2,3-BPG will be increased as well. Okay?
Sir,
Yes.
question po. Is it
Mm.
2,3-bisphosphoglycerate or biphosphogycerate po?
If you can still remember my discussion, it's the same. Bisphospho and this diphosphoglycerate, it's the
No,
same.
sir. It's bis or BI lang po. BIS or BI po.
BIS. Bis.
Sige po. Thank you, sir.
Bisphosphoglycerate and diphosphoglycerate yung isa. 2,3-D and 2,3-BPG. Um, moving forward, for the mechanism of anemia, how is anemia happening inside your body? So number one, it can be either ineffective erythropoiesis or insufficient erythropoiesis. So alisin na natin sa equation ngayon si blood loss, okay? Alisin na natin si blood loss. So automatically, if there is blood loss, in continuous blood loss or in continuous loss of large volume of your blood, automatically it can lead to your anemia. Okay? But what about cases na wala naman pong blood loss, wala naman pong hemorrhage, wala naman pong nagdudugo sa akin, wala naman pong sugat or wala naman pong open heart surgery, what are the possible causes of anemia? The possible causes, ayan, later babalikan ko rin naman si blood loss, but the mechanisms of anemia to start with, ano ba yan? The Okay, ang gulon. Yan. The mechanisms of anemia to start with is ineffective erythropoiesis. Okay? Ineffective erythropoiesis. So this refers to the production of erythroid precursor cells that are defective. An example of this is your megaloblastic anemia. In your megaloblastic anemia, since you discussed already RBC anomaly, is it macrocytic or microcytic? Megaloblastic anemia. It is macrocytic, correct. It is macrocytic. Later, we'll be having a classification chart for your different anemias. Okay? So when it comes to when it comes now to your ineffective erythropoiesis, the problem here now are the defective RBC that are produced. Okay? That the RBC that are produced. Yung rate of production, we can say that is normal, okay? Kasi di-differentiate natin mamaya si ineffective kay insufficient. Okay? Kay ineffective, you have um you have the normal amount of red blood cells, but it is ineffective. Meaning to say, may defect yung mga RBC that are being produced. Either when it comes to their hemoglobin, either when it comes to their protoporphyrin. So all of this will be included under anemia. Okay? We're not dissecting it yet with the different kinds of anemia ha. In general, your anemia can be because of ineffective erythropoiesis. So when we say ineffective erythropoiesis, ano yung mga possible causes? Possible nun, yung heme production hindi maayos, yung hemoglobin production hindi maayos, or possible na yung mismong RBC mo, yung mismong RBC membrane mo may defect. Okay? So later on, we will also be discussing hemoglobinopathies. So when we are talking about ineffective hemoglobinopathies, the quality of RBC is defective. Okay? They are dysfunctional. On the other hand, what about insufficient erythropoiesis? When we say insufficient erythropoiesis, this now refers to the decrease in the number of erythroid precursor in the bone marrow, resulting now to a decrease in RBC production, therefore leading to anemia. An example of which is aplastic anemia. Okay? Aplastic anemia. So, here, in insufficient erythropoiesis, what happens naman is that there is not enough RBCs being produced. And why is that? That there are no enough RBCs being produced? Dahil walang enough na erythroid precursor inside your bone marrow. Eh sir, paano po nangyari na hindi po enough yung erythroid precursor? It is because of aplastic anemia. Aplastic anemia is the inability of your bone marrow now to reproduce not only your RBCs, okay? Not only your RBCs but other um other cells as well, okay? Other cells as well. So it's very important for you to na alam ninyo yung difference between the two. When we say ineffective, tama, possible na correct yung amount or correct yung normal yung levels ng RBC mo. It's just that there is dysfunction when it comes to its ability to carry oxygen or hindi siya nakakapag-function properly. Nakigets ba tayo sa difference ng ineffective at insufficient? Can I see a thumbs up if we're clear? So, ayan. So, thank you so much. So, ayan. So, let's move forward now. Okay. So, megaloblastic anemia is seen in what parasitic infection? What parasitic infection is megaloblastic anemia seen?
Is
Tapos na ba kayo sa nematodes? Pernicious anemia. Oh, baka mas matatanda niyo si pernicious.
Si, ano, sir,
Oh.
bookworm po.
Sino? Sino? The dilatum. Okay? Bago na nga rin pangalan ng dilatum, di ba? It's your dilatum, guys. Tapos na ba kayo sa latum? Wala pa. Hindi pa nga kayo tapos doon. Okay. So, hindi pa pala kayo tapos doon kaya hindi nyo alam. Okay? So, ayan, moving forward, ayan. So, balik na lang ako dito. So, ineffective, Harry, first there's a defect in the RBC. Okay? So, moving forward, let's go now to your blood loss. So, kanina, we were talking about blood loss. So, in blood loss of RBC through bleeding should always be an initial focus in any patient with anemia and should prompt an evaluation of the hemostatic system. So, automatically, kapag ang patient natin comes to the emergency room presenting anemia, okay, symptoms of anemia, the first thing that you always check if there are bleeding, either visible bleeding, external bleeding, or internal bleeding. That is very important, okay? You have to rule that out kasi po pwede namang ang hinahanap mo na mga abnormalities sa cell. Ang problem mo lang pala, may open wound siya internally that continuously bleeds. Okay? So bleeding may be secondary to trauma, surgery, or underlying diseases. So it's very important that you make sure that you are able to find out the reason of blood loss so that you could arrest continuous the loss of blood in that particular patient. So the common location of clinically significant bleeding are actually your gastrointestinal tract. Your gastrointestinal tract, be it in the upper or lower gastrointestinal tract, it is very much common. Okay, so in ulcers, common yan. Okay, in ulcers, you will be seeing internal bleeding in the upper gastrointestinal tract. In the lower gastrointestinal tract, like take for example your hemorrhoids, those are, alam mo yon, take for example hemorrhoids, very common yung hemorrhoids because sometimes akala mo yung hemorrhoids mo is just there, nagbi-bleed lang from time to time, but later on, cumulatively, it can actually lead to anemia kasi continuous yung pagbe-bleed nun. Okay? So naaalala nyo pa in CPH si Milena and hematochezia. Okay, the bleeding, the black tarry stool. So the bleeding in the upper and the lower gastrointestinal tract. And of course, for women, menstruation is one important source of blood loss in women. That is the reason why when it comes to anemia, mas prone ang mga kababaihan. Okay? Why? Again, if I'm going to talk about anemia, it's not just the loss of hemoglobin, but also the loss of iron. So ang daming factors nag-play into factor onto why women can actually develop anemia. Okay? So, kaya common ang anemia sa mga women, it's because of their monthly menstruation. So, that is for the blood loss. So, again, next is hemolysis. So, hemolysis is the shortened RBC survival in the circulation. So, bone marrow will produce more RBC. Therefore, there will be increased reticulocyte counts in your peripheral bloodstream. Okay, in your peripheral blood. So, what happened when it comes to hemolysis? It can either be premature, okay, premature rupture of your cell because of other underlying diseases or underlying enzyme deficiency, and that will now lead also to anemia. So let us just try to encapsulate everything before I move on. In anemia, we're not yet talking about the specific causes of anemia here. Okay? We're just talking about the general mechanism. Okay? General mechanism of anemia. There is anemia dahil ineffective yung erythropoiesis. May nagpo-produce ka ng red blood cells pero may defect yung mga RBC, which you already discussed when you discussed poikilocytosis, anisocytosis, and even RBC inclusion bodies. Correct? And on the other hand, we also have here your insufficient erythropoiesis or RBC production. In this case, possible naman na proper naman yung function ng RBC mo. It's just that their levels are so low. Hindi enough to compensate the need of your body. Okay? And on the third one is blood loss. Okay, itong blood loss na to, we can say that both your erythropoiesis is effective and sufficient. It's just that there is a underlying bleeding at the moment. That's why there is increased blood loss. And of course, meron ding hemolysis. Hemolysis now can be a product, can be a cause of your ineffective hemolysis, ineffective erythropoiesis. Remember that all cells, sabi nga natin, 'di ba, ang RBC na 3M, mataba, matanda, mapangit, sisirain ni spleen. So automatically, all of those will undergo premature rupture or premature apoptosis. Okay? So remember those four, especially the first two that I discussed, kasi as we go along in the different types of anemia, okay, in the different types of anemia, you will hear me say na ito ay ineffective at ito ay insufficient. Okay? So let's move forward. So now, one thing that is very important for us medical technologists to know is of course the approach on how to detect or how to diagnose your anemia. So how do we do that? Okay? We would perform yung gaya nga ng sinabi natin kanina, which is your complete history and physical examination. Okay? But most of the time, these are actually done by your doctors. And maybe some of you are wondering, sir, can we do this? You cannot do this to your patient, but you can take note some of the symptoms that are very much observable during the blood extraction. Because take for example, when I was in practice, usually, take for example, we have a patient, tapos we were already running their samples inside the laboratory, and there are some abnormalities. And then usually, the person that we go to is the person who extracted the blood. Ma'am, anong itsura nitong patient na to? Jaundice ba siya? Maputla ba siya? Is the patient experiencing like this, like that symptoms? And of course, it pays actually to be an observant na phlebotomist. Hindi dahil osyosera ka, but because you actually would want to know, lagi nga nang sinasabi natin, di ba? Part siya ng pre-analytical ano natin na you don't just ask the patient ano yung mga preparations niya because those things can actually affect your test, but also checking the condition of your patient at the moment na kinunan mo siya ng dugo. Okay? So you cannot see that in the book na check the patient's condition. You will not see that in other books. You cannot see that in your MACOL or in other phlebotomy books. It's just that it's an instinct that we should all develop so that when we go and check the specimen of your patient, you would actually have a better perspective onto why these things are happening dun sa pasyente mo. Okay? Next one. Okay? Next. For the laboratory diagnosis, these are the things that you need to do. Your complete blood count, your reticulocyte count, peripheral blood film examination, and your bone marrow examination. These things are actually laboratory diagnosis or laboratory test that would actually check onto what mechanism is actually happening. Nakukuha? Are you finished with CBC? Diff count? Are you finished na sa lab? RBC, CBC, hindi pa. Reticulocyte count? Wala din pa. Peripheral blood smear? Yun pa lang. PBS, okay? PBS is actually very important. Ito yung ano natin, no? Maybe some of you are wondering, sir, ba't nyo pa kami kailangan turuan ng manual? Meron naman ng machine. Okay? Machine can detect and can count. But at the end of the day, the medical technologists will still do a double checking ano man yung resulta na ilabas ni pasyente nung machine. Too high, too low, you will always check it manually. Okay? That's why it's very important for you to listen carefully dun sa ano. The bone marrow examination. The bone marrow examination are actually being done by pathologists. Okay? These are being done by pathologists. But it's actually also very important for us because medical technologists can actually specialize in hematology and they can also read blood smear in the laboratory. Okay? So in this test, okay ha, in this test, check natin ha if we are able to check the mechanism. In RBC, I can actually check both the ineffective and insufficient. based on the RBC count and the hemoglobin count, and even in the RBC indices. Okay? In the reticulocyte count, I can actually check this. Okay? Remember, in insufficient... Shopee 1111! Ang ingay ng Shopee. Ano ba yan? Nakakagulat si Chris Aquino. Ayan. So, I need to throw my phone on my bed muna. Ayan. So, kung hindi naman yung kaibigan ni LJ yung nagsasalita tuwing hima, yung ano naman, di ba? So, going back, before I was rudely interrupted by Chris Aquino. Okay? So, when it comes to reticulocyte count, you would actually check the inefficiency or insufficient erythropoiesis using your reticulocyte count. Remember that your reticulocyte count will only come out of the bone marrow, and then after 1 day, it will already mature into your mature RBC. Question, what do you may question lang ako. Were you able to discuss what is the RBC, what is the enzyme deficient that kung bakit meron ka pang RNA remnants in your lab? Ayan. So later may papakita akong PowerPoint sa inyo ha. Sabihin nyo if that was the PowerPoint presented to you during the per kilo para yun na lang din isesend ko sa inyo. Okay? So in the ayan, balik ako dito, peripheral blood film examination. In the peripheral blood film examination, you will now be able to check macrocytic, microcytic RBC. You will now be seeing hypochromic and hyperchromic RBC. What is poikilocytosis? What is poikilocytosis? Let's go with poikilocytosis. King Claire. What is poikilocytosis?
Variations po sa color.
Is it color? What is poikilocytosis?
Shape po. Shape po pala.
Shape. Okay. Variation in shape. Anisocytosis, variation in what? Anisocytosis, variation in?
Size po, sir.
Variation in size. Your anisochromia, variation in the color. Okay? Yun yung sa color. So, paano nyo tatandaan? Pag poikilo, yung letter P, shape. O, di ba? Yung shapes, letter P, shapes. Anisocytosis, yung S, aniso, is yung size. Anisochromia, C, color. Okay? Chromia, color. So, let's move forward. So, that is the peripheral blood film examination. Okay? So, I think ang sabi sa akin sa laboratory, i-discuss yung different method of checking your peripheral blood smear. So, now let's go to the other classification of your our anemia. So, in the classification, okay, we can actually check it morphologically and etiology. The etiology of anemia. So, morphologically, we can check the morphology of your RBC using your RBC indices. Okay? Using your RBC indices. So, with this now, okay, we will be able to detect the different types of anemia. Okay, the different types of anemia. So as you can see here, these are your erythrocyte indices or your RBC indices. So your mean cell volume is a very important indicator. Makikisulat ako sa gilid ha. Your MCV would give you the variation in the sizes of your RBC. So if it is macrocytic or normocytic, or if it is microcytic, it will be provided to you by your MCV. Your MCH is rarely used, okay? Rarely used si MCH. But what is mostly common and used in the laboratory is your MCV and your MCHC. What is your MCHC? Your MCHC is your MCHC gives you now if it is a hypochromic or hyperchromic erythrocytes. Okay? Hyperchromic or hypochromic erythrocytes. So, moving forward, let's go here. So, erythrocyte indices, your hyperchromic erythrocytes are usually caused by shape changes such as those are that are found in your spherocytes. Hyperchromia is not used in an actual description of your erythrocyte morphology in the lab. So we're not using hyperchromia in the in describing your erythrocytes in the lab, but when it comes to when it comes to RBCs, okay, RBCs that cannot accommodate more hemoglobin, they cannot accommodate hemoglobin greater than 38 grams per deciliter per RBC. Okay? So, therefore, as a result, above 38 grams per deciliter should be recalculated. So, if above 380, okay, 380 grams per liter or 38 grams per DL ang iyong hemoglobin, you would need to check the hemoglobin levels. Okay? Hemoglobin levels. There are, remember here, eto, pakita ko ulit, 32 to 36 grams per DL. 36 yung upper limit. It is actually uncommon to see 38. Even though we will call it hyperchromia or hyperchromic, it is actually rare to see 38. That's why if you see 38 grams per DL in your 38 grams per DL in your testing, you would need to what? You would need to um double check or recalculate the hemoglobin of your patient. Okay? Babalik lang ako dito. Okay? Babalik lang ako dito. So, again, very important sa MCV and MCH. Why? Because of this table. So, papakita ko sa inyo yung table so that you would be able to see what are those that are microcytic, macrocytic, and normochromic anemia. Okay? Normochromic anemia. So, normocytic rather. So, as you can see, okay, nakikita po ba dito? Nakikita ba yung chart? It's actually on page, if you're using your book, it's actually on, I'm already on page 259. Page 259, figure 16-2. Okay? So here, okay, we have the microcytic, macrocytic, and normocytic erythrocytes. Okay? So meaning to say, babalik ako sa MCV saglit, 80 to 100 femtoliter. Okay? If it is less than 80, we call it microcytic. If it is greater than 100, we call it macrocytic. Okay, are we clear? Pag sinabi nating microcytic, yung RBC mo are smaller than the usual 7 to 8 micrometer na diameter. Pag naman macrocytic, mas malaki sila, greater than 8 micrometer. Are we clear? So, what are those anemia that can cause that presents a microcytic na RBC. We have your sideroblastic anemia, we have your iron deficiency anemia, and the anemia of chronic inflammation and thalassemia together with your hemoglobin E disease or trait. So, the first anemia that we actually are going to discuss is your iron deficiency and then your anemia of chronic inflammation. Your sideroblastic anemia, okay? Your sideroblastic anemia is something related to your heme, okay? Something related to your heme. So, guys, naintindihan ko if these things will be overwhelming at first. That's why I need you to ask questions later on when we discuss these topics, okay? So, punta naman tayo kay macrocytic, okay? What are those type of anemia that are presenting enlarged RBC? Okay, that are presenting large RBC. Hindi dahil malaki yung RBC, di ba, baka maging notion natin, hindi ba sir mas malaking RBC, mas madaming hemoglobin, mas madaming madadalang oxygen? It's not like that. Okay? Hindi ganon. Okay? So what are those that are macrocytic? Okay? What are those that are macrocytic? We have here your megaloblastic and your non-megaloblastic. Your non-megaloblastic anemia are your aplastic anemia, your chronic liver disease, and even your alcoholism. Okay? What are those that are megaloblastic? Okay? What are those that are megaloblastic? Megaloblastic presents um, are those that has vitamin B12 deficiency, folate deficiency, myelodysplasia, erythroleukemia, and the use of other or some drugs. So, what do we mean by non-megaloblastic form of macrocytic anemia? Okay? When we say non-megaloblastic form of macrocytic anemia, they are characterized with large RBC. Okay? With large RBC. But in contrast with megaloblastic anemia, they are typically related to membrane changes that are caused by a disruption in their what? In their membrane. Okay? In their membrane. Unlike now, unlike your megaloblastic anemia that has to do with the what? That has to do with your vitamin B12, your folate, and other conditions like myelodysplasia and erythroleukemia. Okay? And erythroleukemia. So here, again, macrocytic anemia. Macrocytic yung cell, meaning to say, malalaki yung cells. We have non-megaloblastic and we have your megaloblastic. Okay? We have your megaloblastic and your non-megaloblastic anemia. So, lastly, we have those RBC that are normal in size. Okay? Normal in size, normal din when it comes to the normochromic din sila when it comes to hemoglobin content. It's just that there are hemolytic diseases, the hemolytic anemia here, okay? So in normocytic anemia, okay, dalawang bagay. You would check the reticulocyte first. If the reticulocyte is increased, meaning to say that is an hemolytic anemia. Hemolytic anemia that can be due to intrinsic or extrinsic causes. When we say intrinsic, ibig sabihin, there are defects with the RBC. This is now part of the ineffective erythropoiesis. Okay? Ineffective erythropoiesis. So meaning to say, may problema sa membrane, may hemoglobinopathies, or may enzyme deficiency. Okay? May enzyme deficiency. Normal yung itsura, pero merong problem inside. There are also those that are extrinsic, meaning to say, walang problem yung RBC mo. Are you getting me? Walang problem yung RBC mo. It's just that there are extrinsic factors coming either from your immune system or it can actually be due to microangiopathic or macroangiopathic. Later, we'll elaborate that when we reach this part. We also have infectious agents. May mga infections that can cause hemolytic anemia. There are some drugs, chemicals, venoms, and even extensive burns. So nakukuha po tayo when it comes to hemolytic anemia. There are hemolytic anemia that is due to intrinsic. Ibig sabihin, may problema na talaga to start with yung RBC mo. Are we clear? And there are extrinsic factors. Ito naman, dahil to sa mga external factors like your immune system, okay naman si RBC. It's just that there are certain conditions that will affect your RBC. That's why there are premature lysis in your system. Are we clear with that? Hello, are we clear? So, next, we have here anormocytic anemia but has low to normal reticulocyte count. And what are these types? We have your aplastic anemia, anemia of renal disease, myelofibrotic anemia, infection like your parvovirus B19, and anemia of chronic inflammation. Kung makikita ninyo, anemia of chronic inflammation is here and also in the microcytic. Later, we will discuss that further. So dito, bakit sir low to normal? Very distinct ito when it comes to aplastic anemia. Aplastic anemia is an example of insufficient erythropoiesis. Okay? Insufficient erythropoiesis. Ibig sabihin, ang problema mo is yung production ng iyong RBCs. Okay? Yung production ng iyong RBCs. That is for aplastic anemia. So, right now, okay, I want you to check your chat box. I'll be sending you a classification, okay? That classification is actually um being used. Okay, wait lang. Ayan. This classification is actually being used in differentiating your anemia. Okay? We have your microcytic hypochromic. Madalas kapag maliit, konti lang din yung hemoglobin. That's why it is also hypochromic. But meron din tayong mga normocytic and normochromic, and meron din tayong normocytic and normochromic. Ibig sabihin normal in size, normal hemoglobin content, but there are still anemia in that. Okay? So, why am I showing you this? I just want to remove the common misnotion na when it comes to anemia, laging microcytic. Hindi. Hindi dahil maliit yung RBC mo, not because your RBC has lower hemoglobin content, that doesn't mean na yun lang yung magkakaroon ng anemia. Because there are RBCs that are normal in size, large in size, that can also cause your anemia. Okay? That can cause your anemia. So, can I move forward now? So, tatandaan nyo ito ha. So, madalas ang mga nagiging questions in the case studies kasi would be what type of anemia would that be? It is a normocytic, normochromic anemia, mga ganon. So, paano mo malalaman? Okay? How would you know? Okay? How would you know if it is a microcytic or macrocytic anemia? What parameter are you going to check? Can I see it from the chat box? What parameter should I check for me to know if it is microcytic or macrocytic anemia? Saan ako titingin? Wala pong nag-chat. It's in your, ayan, meron nang sumagot. It's your MCV, correct. Okay? Microcytic, macrochromic, MCV ang titignan. Okay? Meaning to say 80 to 100. Okay? What about your hypochromic or hyperchromic? You can see that where? What RBC index? Your MCHC, correct? Okay, your MCHC. So, having said that, it pays to memorize the reference interval for both your MCV, which is 80 to 100, and your MCHC, which is 32 to 36. Okay? 80 to 100 and then 32 to 36 grams per deciliter for your MCHC and femtoliter for your MCV. Okay? So, can we move forward? Okay? Let's move forward. Let me now define to you what is relative anemia and absolute anemia. So relative anemia means RBC mass is normal and plasma volume is increased. Okay? So this is secondary to unrelated condition. This is usually transient, and this is actually just because of hemodilution. Okay? Hemodilution due to pregnancy or volume overload. What do we mean by that? Um, remember that relative anemia, ibig sabihin nun, when you centrifuge your whole blood, mas madami yung plasma, kakaunti lang yung RBC. That would look like anemia. And remember, 'di ba, sabi ko nga sa anemia, it can either be because of insufficient hemoglobin or insufficient RBC count. Okay? Insufficient RBC count. Buti pa si Vian kumakain na. Insufficient RBC count. So the problem there, okay? The problem there would actually be number one, your hemoglobin count or your RBC count. In this case, nagmumukhang konti yung RBC mo dahil mas marami yung plasma mo. Okay? That is just relative anemia. Okay? That is just relative anemia. And this is usually transient. Okay? Usually transient. What about your absolute anemia? Yung absolute anemia natin, ito talaga, si anemia. Absolute anemia, RBC mass is decreased, the plasma volume is usually normal, and this is indicative of true decrease in erythrocytes or your hemoglobin. Talagang may decrease sa RBC mo or sa hemoglobin mo. Hindi to dahil sa dilution, kundi dahil mababa talaga sila. What are the usual mechanisms that are involved here? It can either be the decreased delivery of cells in the circulation, again, again inefficient um inefficient this one again inefficient na RB erythropoiesis, so decrease in the number of erythroid precursor or impaired or defective production, increased loss of RBC in the circulation. It can either be through hemolysis or yung ating bleeding, okay? Bleeding or hemolysis. So your bone marrow here can respond giving off now reticulocytosis, okay?